Okay, so can everyone see the screen? I'm hoping. Okay, great.
Looks great.
So thank you everyone for being here. We have a terrific crowd. I was a little concerned I might be talking to myself, but that's obviously not the case, and there's a lot of interest in this topic. I am Claudia Schlossberg. I've been around DC a long time. I am a member of the Mount Pleasant Village, and I currently chair a committee of the DC Long-Term Care Coalition that focuses on the workforce crisis. We've been working on this issue now for 3.5, 4 years. And we've made some great progress, but we wanted to provide this briefing because we think this is a topic that is of uh, really major concern for anyone who is aging in our community or across the country. We have a workforce crisis with respect to healthcare workers, and particularly the direct care workforce, the people who provide hands-on care to individuals who need assistance with activities in daily living, with bathing, dressing, eating, transport, some of what we call the IADLs, like cooking, cleaning, just caring for ourselves, or if we need to go into a rehab facility or a nursing home or assisted living, the people who provide assistance in those environments. So this presentation is focusing on how the direct care workforce shortage affects us as seniors aging in DC, how it affects our neighbors and our families. I want to thank LeadingAge DC for working with us. They've been great partners and collaborators for the last several years now, working on these issues, as well as DC Appleseed. And this presentation wouldn't be possible without the help and assistance and hard work of numerous village members. And you'll hear more about that in a minute. So the problem, in summary, is that we have many older adults and people with disabilities in the District of Columbia who are going without needed care and assistance due to the severe shortage of trained and qualified direct care workers. And without caregivers, without direct care workers who can provide that hands-on assistance and help with tasks, older adults and people with disabilities are not going to be able to age with dignity in their own homes. The data, we've been tracking this now for several years. We have done 3 workforce surveys, and we're in the midst of doing our 4th workforce survey. In the last survey we did, which was the beginning of this year, January 2023, we surveyed long-term care providers in the district, including home health agencies and nursing facilities, assisted living, and adult day health. More than half of them said they have had to refuse to take a new client because they could not provide the staff that the client needed. We know that the situation is actually getting worse, and more home health agencies and more nursing homes are having to refuse to care for older adults. This fall, home health agencies had to reduce the hours of care that they provided to their clients because of staffing issues. And in the past year, we've seen several nursing homes have had to close beds to new admissions because of staffing. When that happens, it's kind of like airplanes stacked at, waiting to take off. If you've been in a hospital, for example, and need to go to rehab for short-term rehabilitation, or you need home care, you need assistance to go home, older adults are spending more time in the hospital and also spending more time in the emergency room because hospitals cannot clear their beds. So, we're just sort of stacking people up like those planes on the runway. And all providers across the entire spectrum are reporting high vacancy and turnover rates. We also know from some of the data we've gotten from the Board of Nursing and from some of the schools that we've been working with that DC is not training enough new workers to fill vacancies. So I'm going to turn it over to Mary. Mary, I hope you can see this.
I can, yes. You can't see me because my computer is a little bit ornery about when it shows me and when it doesn't. But I am a member of the Capitol Hill Village and I have been a member of the advocacy team at the Capitol Hill Village for 4 years on this issue and earlier years on other issues. I will be 82 in February, and I realized from looking at the people around me that in a few years, the hidden voices you are going to hear from could be you or me. And you will hear from these videos what they experience, and they do not have the strength to come and stand and present testimony to the city council. This is their testimony. So with that, I introduce the first of these hidden voices.
I just want to add, Mary, that all of these videos were taken by village members, other village members, and I want to shout out a thank you to Rick Reinhardt, who instructed us and trained those who shot the videos how to do this. So thank you, Rick. Mary, do you want to introduce?
Oh, this is the caregiver crisis affects older adults, that's for sure. Dolores Woods is a very sweet person, but she is going to describe real hardship from when the caregivers do not show up.
Okay, this works.
My name is Dolores Woods. I am 84 years old, but I have heart problems. I have asthma, and I have kidney failure, and I don't know what else. Rose, she comes, she helped me put my clothes on, she helped me put my pamper on, she helped me take baths. She did pretty good. She helped clean up the room. She just take care of me very good. If I don't have a family at work, I just have to wait until I can find somebody, they can find somebody to come in and work with me. If they can't find nobody to come in and work with me, I'm just here by myself. But I cannot go downstairs by myself. And I can't go to the bathrooms by myself. So I just have to stay here and wait for somebody to come. Either I call my son-in-law, and he would just leave his job and come to see what's wrong, with me. If the agents try to find somebody and they can't find nobody, then I'm just here.
And the caregiver crisis also affects the young. I would like you to listen to James Jean Claude, a young man who suffered a traumatic injury young.
My name is James Jean Claude. I'm a native Washingtonian. I'm also a spinal cord injury patient, and I require home aids for my daily life. I receive home aid support 14 hours a day, 7 days a week. Essentially, I need someone to do everything for me. As you see, I can move my hands, so they don't have to feed me per se, but I can't get to the kitchen, so they bring me my food, they bring me drinks. They help me with stay on schedule with my medication. They also help me get dressed. Because of my condition, I can't take a shower, so I get sponge baths every day. So I have a neurogenic bladder and a neurogenic bowel, so I have to wear diapers, and so my aides also change my diapers whenever nature calls. About 4 months without any homemade care when I transferred from the nursing home. So those 4 months were extremely difficult. All the burden of my care fell on my mother's shoulders. She's now 75. Sometimes it was aides that weren't well qualified or experienced with people who are bedbound and how to change diapers. If I've gotten bed sores before, because of inconsistent care, depended on aides, yeah, they're my lifeline. My name is
And we will, the caregiver crisis also greatly affects family members, as you just heard from Jean-Claude. And we will hear from the family member that was caring for the woman. We will hear from and down the line in a few more videos. So I look to her, and she wants to remain anonymous.
I went out on FMLA leave from my job in Ohio. I live in Columbus, Ohio, because my mother had her leg amputated. My mother is 90 years old and lives alone in her home. And without a leg, it means an additional amount of care. And that included me. So I took off 2 pay periods, which is a big hit to me and my family. But it was needed to be done because I found that managing both my job, my home life, and my mother's life, and all the care that she needs was impossible and too stressful. Means that I have to be here to go through insurance plans, to have all the banking coordinated, to if somebody cancels when we have an aide scheduled or they can't find somebody to come in, I'm the person that's responsible for taking care of my mom's health. So for us, we're finding that the weekends are the hardest. The weekend mornings, Saturday and Sunday mornings. So my mom would spend the whole night. We'd have a family member here, wake up, there's no care for her. So I'm the one that has to change the diaper. I'm the one that has to make sure that she can be cleaned, throw away everything. That means she's bedbound. How do I change her? How do I roll her over? I had to learn all these skills that I'm not very good at and that my mother did not want me to do. And can't tell you how thrilled I was not to be doing this. But these are the things that you end up having to do when you can't have the care.
Oh, dreadful. So, who are these workers? We know that 80% of the direct care workforce is women, are women, and disproportionately, direct care workers are people of color, Black and brown women and men. Many are immigrants. The median age of the workforce, sometimes we think that this is a job that young people would take, but actually the median age of the workforce for women is 43 and for men is 39. But nearly half of the direct care workforce are living at or below poverty levels, and half rely on some form of public assistance, mostly Medicaid or food stamps. A major issue, and one that we think is really primary, is how much that these workers get paid. You've heard about how difficult the job is. There's a lot of skills required. It's a very personal job. You're involved with intimate care for individuals. You have to have interpersonal skills. You have to have skills about how to care for someone. But in fact, this job has primarily been a job that has paid at or just slightly above the minimum wage. This job also requires in DC that the workers get certified, which requires 125 hours of training, plus taking an exam, and then being certified and overseen by the Board of Nursing. You actually have to take continuing education credits. You have to be able, if there's something that goes wrong on the job, you could be put into a national registry. So there's a lot of responsibility that comes with this job, as well as costs. Training costs can be $1,500 to $3,000. Yet, when you come out of that training and get your license, most likely you're going to be starting at about $17 an hour, which is the current minimum wage or living wage in the district. We know if you just scan the want ads, dog walkers in DC are getting 17 to 19, even sometimes $21 an hour. You can go get a job as a cashier at Walmart or Target and make $17.50 or even up to $23 an hour. And childcare workers, which is probably the most comparable job when we think about it in terms of skills and training, they're making initially $22 to $25 an hour. So there's a big difference. In DC, particularly since most of the care is paid for by Medicaid, the average pay right now is about $18.70 an hour, meaning the median pay. And that means you can start out less. You might be able to make a little bit more, but right now DC is reimbursing home care agencies so that they can maintain an average wage of $18.70 an hour. We've talked to aides who have worked for 7, 8 years, and they're still just making maybe $19 an hour. So the need for a progressive wage scale, for making sure that people are compensated, not just for the job itself at a decent salary, but that there's a progressive wage scale recognizing experience as well as advanced credentials is really necessary. So in DC, a direct care worker can make anywhere from around 35 to 39,000, depending on how many hours that they're working. Hours are often not consistent. This is not like a salaried position where, you basically get paid for the hours that you work. And in a national ranking of states, $17 an hour may sound like a lot if you're living in Georgia or Missouri, where the cost of living is lower. But when you factor in the cost of living and you look at competitive salaries for comparable jobs, DC ranked last among all states for the competitiveness of wages paid to direct care workers. Back to you, Mary.
So, and now we are going to hear directly from a home care aide. Her name is Felicia Higler. I hope I pronounced it right, and who lives in Washington, DC.
Hi, my name is Felicia Hagler. I live in Washington, DC. I've been home health aide for over 25 years, but I have been caring for people all my life. I love helping people coming through their house, getting to know them as a person and helping them with their everyday needs, such as bathing them if they need it, clothing them if they need it, taking them to the doctor if they need it, sitting down talking to them, having a regular conversation with them because they are people too, regardless of the disease. All in all, I just enjoyed what I did, but the companies that hire us don't do enough for us, such as giving us sick leave, annual leave, and the money sucks. So anytime a person is doing this, they're doing it because they care for the individual, because if it was about the money, you would have no one doing it.
And here we are going to hear from the mother of the woman that we heard from earlier, who is her caregiver when there is no one else around, and she's very eloquent.
I am a member of one of the local DC villages and have been since 2009. My current medical situation has deepened what was a potential crisis before. I cannot, as my daughter said, manage right now and may not be able to manage with the various aspects of hygiene and other things that come up until one is mobile. I am not mobile. I cannot walk around the house. Yes, in the rehab facility, it turned out that because the facility lacked enough help, they had to pile additional patients if someone didn't show up. they had to reassign the number of patients. And those of us who were patients, therefore were in a wider field for one person to do all the hygiene and the medications and the transport, was that one would wait 2 or 3 hours for the hygienic services. If you can't use the bathroom yourself, you have to wait. And they were so busy just distributing meds in that 3-hour block in the morning, they simply couldn't take the time to stop and do what needed to be done and the cleanup, and then separately serve the medications, serve breakfast, and handle 22 patients in a 3 or 4 hour block. And of course, it was difficult. They were lovely, gracious people working very hard. And sometimes they had to do a double shift because you can't really leave without anyone to replace you. Sometimes people couldn't or didn't show up. They're poorly paid, underappreciated. Higher pay might attract some people. Ma'am,
So we wanted to pause here because we've heard a lot of first person accounts and just kind of listen to you and hear how you're reacting to what you've just heard. So I think I can stop sharing and then reshare. Does that make sense? Let me do that so we can get, and then if people want to raise their hand, if they know how to use that function, or unmute themselves, we'll spend a few minutes. And then when we come back, we're going to talk about solutions. We're also going to hear from Jake McDonald from PHI International, which is a national organization that works on addressing this workforce crisis and improving the quality of jobs of direct care workers. So why don't we pause a moment and see if there's any reactions to what we've just heard?
I mean, I can start. Hi, I'm Nadia Mercer with Greater Brookland Intergenerational Village. And I think that the testimonies were a really powerful way to bring these people's voices to our attention when they're unable to leave their homes. And their stories need to be shared. It is heart-wrenching, and we have to do something about it.
Thank you. Others, don't be shy.
I was glad that the woman, I'm sorry, this is Judy Berman, I'm with Capitol Hill Village. And I was glad that that last person talked about what's going on in the rehab and the care facilities, because, I mean, you know, literally just yesterday I heard about somebody who waited an hour and a half to be taken to the toilet in the middle of the night, you know, and this has happened twice. And it's the kinds of indignities, you know, and really this is, it's no longer just, you know, nursing home. It's really, it's affecting everywhere. So I'm glad you talked about that, because I think that's really a pressing issue as well, is just it's basic dignity, and it's people getting the treatment that they need and deserve.
I'll say a few words. I'm Frank Finnemar. I'm the executive director of the Cleveland Woodley Park Village. I'm also the primary caregiver for my mother, who will be 93 soon and has Alzheimer's. I couldn't work if I didn't have the 2 caregivers that I have. I've had different agencies and individuals, and it's really tough to find them. And so it's not just in long-term care facilities as well as private homes. My mother was in a very reputable hospital, and because they were so short-staffed that she actually sat in her own urine and excrement for more than 6 hours. The hospital has heard from me on that issue, and I'm waiting to hear back from them. But it's a real crisis, I think, about how we value people, particularly older adults, as human beings. And I think I'm really looking forward to getting to the solutions, because this problem, from my perspective, couldn't be more grave.
Great. I see. Makeda, do you want to call on the folks with hands? Because
Sure, I saw Robin Sanderberg's hand first, and then Barbara Sullivan.
Yeah, hi, I'm Robin Sandenberg with the Mount Pleasant Village. And I'm sure you could have these kinds of Zooms all over the country, but it's exceptionally disturbing to find out that we are the worst. We are we are lagging behind everyone else. And I'm sure there could be a 1 hour explanation of that, but is there a kind of a quick couple of bullet points as to why that's the case?
Well, it's relative. So we have a very, very high cost of living here. And as a result, even though wages relative to, for example, what a direct care worker might get in North Carolina or Georgia or, seem higher, when you have to look at competitive wages for entry-level jobs with similar or lower entry-level requirements. So we know during the pandemic that many other essential workers, cashier at the grocery store, the people who deliver food to the door, retailers understood that they needed to raise wages in order to get people to take these jobs. One of the things in this area is that so many of the workers, more than half of all long-term care spending is paid for by Medicaid. And so Medicaid kind of makes the market. So if the government is not raising those wages and reimbursement rates for providers, it kind of depresses the whole market. And so that's one of the explanations. Jake McDonald, when he comes on, he can probably speak to this as well.
Thanks, Claudia, and thanks for your question, Robin. Barbara Sullivan, please go ahead. And then Nefeli.
Hi, thank you. I'm Barbara Sullivan. I'm the director of Village to Village Network, the national organization. And I too just came off of being a caregiver for the last about 2 years for my husband. And at the end, we had, hospice in place, and we saw a significant difference in the shortages and even that level of care in home, in community services, not just the nurses, but also the aides coming in and the availability. And, the one thing that I will say, the caveat with the local hospice team was that another organization called Caring had a grant from the state and allowed for a respite, aid to come in and help me under these rules. But we see it, and I'm hearing it right across the board. And the other component I'm hearing more than anything else is weekend staffing in hospitals. And do not get sick on a Friday afternoon, because unfortunately it's a very scary thought that they're not going to actually see some of the regular staff. You're seeing, the secondary staff coming in. I'm not saying you're not being treated, but there's, a disconnect with the shortages. And I also want to throw out one more thing, and that is when you're coming up with solutions is getting local colleges and universities and training programs for staffing shortages. I think that's the way we go as we're moving forward. And it's as simple as training CNAs or giving incentives for, financial assistance to get some of these folks trained. So that's all.
Thank you.
Thanks, Barbara. Please go ahead. Is it Nefeli?
Yeah, Nefeli, thanks so much. Yeah, I appreciate all of those comments. Just another response to the testimony videos. Just appreciating the family, sort of unpaid family caregiver video, because I think it highlights the fact that our system, that most caregivers are family members or unpaid family members. Just statistically, I think that's true. And so the financial, economic, long-term impacts of that are pretty significant. And so that feels like a story that needs to be made clear. I think there is perhaps an assumption in folks that that at some point professional care is needed. And I think the reality is that most care is actually offered by family. Because we don't have a system in this country. So just echoing that, I want to lift up that strain of testimony. And then also I think to the point that Medicaid does reimburse for long-term care and for CNAs and health aides, that's a particular segment of our population at a very, very low income and low asset level. And so just thinking about the needs of that sort of middle income, when it's private pay, when it's paid by individuals and families for that kind of support, and how that takes a toll sort of in the middle, right? The middle bracket.
And Nefeli, I appreciate your comments. We don't have time to talk about it today, but there are some ways that Medicaid can actually raise the income level so that more, I don't want to say upper middle class, but sort of low to middle class folks can access the services in Medicaid. That's a whole nother conversation, but thank you for raising that.
Thank you, Stephanie from Northwest Neighbors.
Yes, hi. Thank you for having this discussion today. It's so important. And I just wanted to point out, when we talk about dignity, how everyone involved in this system, the dignity of all of those people are being challenged right now. Not only our older adults, but also the CNAs and the workforce who are not being paid well, who are asked to do more with less. There's a lot at stake being a CNA. You can injure yourself and not be able to work ever again. This is not like, nothing like being a cashier or a dog walker. This does require a great amount of skill and a lot of creativity, especially if you're working with people with dementia who have a desire, a sort of, not a desire, but a tendency to want to leave or get confused or become agitated and combative, and to also deal with the family stress and be sort of that in-between person. So this position requires a lot of skill. And I love, I think it was Barbara who suggested tapping into the colleges. I was actually a CNA through all 4 years of college, and it was better pay than being a cashier, actually, which was appealing when you're 18 years old, but it wound up creating the trajectory for my professional career. I fell in love with working with older adults, and think there's a real opportunity to use a younger workforce who have the strength and the flexibility to help with this, solve this problem. Thank you so much.
Yeah.
Thank you. Deborah Gilman.
Hi. So my husband was had a bad surgery and was handicapped for 7 years. And I tried with about 12 agencies. And finally, the only way he could get help is by our paying independent caregivers directly, because as a couple of them during the years just said, this is too much work for, $15 an hour, $16 an hour, and just would refuse to do many of the things. So we paid about $32 an hour directly to the independent caregiver, and thanks to people from other villages, and links is how we found them. And so that was very disheartening. But thank goodness we found 2 people, one for the weekend and one so these were strong men who are also, it was heavy. My husband was heavy, bed to wheelchair and the whole thing. He could feed himself sort of. So anyway, that's what it can end up with. And it's difficult. I have lots of stories, but I won't bore you with them. Thank you.
I think we have time for just a couple more, and then we want to talk about solutions, but there's obviously much more to talk about. Go ahead.
Yes, absolutely. So Judy first and then Susan, and then we'll close out our reflections. Thank you,
I
everyone. for
just
sharing.
wanted to, well, first, thank you. And to add to the point that the mother who was bedridden at the end is there are people who really love the job and want to do it well. And how someone else said, how we disrespect the work and we disrespect the workers. And that even if you are the home caretaker, it's a hard job. It's a life job. So there's something about gathering our forces about what's important. It isn't something that I just go to my job and I go out with my friends, but I've got this caretaker. And I wonder, is SEIU or is there a way are workers trying to organize in some way so that they have a united voice? Or I just can't believe there are people who really love the job, who will be there, and how disrespected they are, and then the resonance of that on the lives of others.
So Judy, just so you know, SEIU has been a very important and active member of our committee, and they have lobbied with us on our legislation and have helped organize. One of the things we've learned, and one of the reasons why we filmed the direct care worker who you heard from, is that they're often unavailable to testify and go to council and meet with council members because they're working sometimes 2 jobs and they have families and they can't take the time off. But we can have a separate conversation about some of the challenges of organizing this workforce, but SEIU has been a very, very important partner in our work here.
I think we have time for one more. So Susan
Okay.
Davis.
Yes, I'm Susan Davis from East Rock Creek Village, and we've had members that have had a great deal of difficulty because of the delays in getting home health workers, and also recently someone that was in rehab who was kept in bed. She was considered a fall risk, but there was no one there to help her walk, or even walk her to the bathroom. And by the time she got home, she was incredibly weak, though she was not a fall risk. Anyway, it was very unfortunate circumstances for her, though she's recovered and regained her strength. The thing about home health aides now, and we have one agency that has now told their home health aides that since the pandemic funds are gone, and DACL has evidently told not paying for overtime for home health aides anymore. This is one of the ways that they manage the staff, and that these women manage to make a living is by working 7 days a week or working extra shifts, and they get overtime. And now they've been told that they can still work extra, but they will not be paid overtime, which I know is totally illegal. But that's what's happening in the District of Columbia right now.
Thank you for sharing that, Susan. I want to get back to solutions. I see one more hand, Anne, and maybe we can cycle back to you after we finish the presentation. I know this topic is important, and it's meaningful. People have a lot to say, but I want to get to solutions and get to Jake as well before we run out of time. So let me go back to sharing my screen, and hopefully this all comes up. Whoops, we gotta get back to here. Let me do this. Okay, so I wanted to talk about some solutions. As you heard earlier, our direct care workforce committee, our workforce development committee in the Long-Term Care Coalition has been working in coalition with SEIU, with DC Appleseed, with LeadingAge, with the DC Healthcare Association, with the DC Home Health Association, with Minka, and with various villages, Capitol Hill Village, Northwest Village, and others on both research and data collection and lots of discussions. And it is not just our opinion, but I think the opinion of noted experts that we have to pay direct care workers a competitive starting wage. We're not going to attract people to become CNAs or home health aides unless they know that when they complete their training and take their certification, they will end up with a competitive starting wage that will pay them enough to support their families. We also have talked about the need for progressive wages so that if you want to stay in the job, I often liken this to the federal government. We see incredibly high retention rates in the federal government because people know they're going to come in at a certain GS level, and there are incremental increases in salaries most years, and that eventually their salary will continue to grow. That is not necessarily always the expectation for a direct care worker, again, because of the way these services are mostly reimbursed. We also want to provide for more advanced credentials, for example, medication aid certification that would pay more money as people go back to school or go back for training to advance their skills. Training costs are a real barrier. There is some progress here in that DC did set aside some funds this year for a new scholarship program, but it's not nearly enough to train all the aides that we need. But we need to eliminate costs for training and certification. Again, paying $2,000-$3,000 for training and then getting a job that pays $17 an hour just doesn't make sense, right? We also want to increase the pipeline of new workers. We have schools in the district, charter schools that are interested in bringing these programs into the high school curriculum, particularly for those students focused on healthcare careers and have an interest in healthcare, as a way to get them exposed early in their careers, get them trained and certified, and working part-time, maybe picking up some of those difficult shifts on the weekend or evening hours. And we also know that during the pandemic, DC allowed Maryland and Virginia aides to work in the district without additional certification. And we think we need to make that permanent. We actually have been working with the Board of Nursing, and hopefully we'll move forward proposals for reciprocity. But right now that's not allowed. There's a lot of different regulatory barriers, and so we have proposals to modernize those regulation and eliminate requirements that basically become obstacles and barriers to people either attaining certification or maintaining that certification. At the same time, we don't want to reduce quality standards. And then we do know that we have to provide more accommodation for trainees and licensees who have limited English proficiency. They may be completely proficient in English from an oral perspective, but taking a multiple choice exam on a computer that's only available in English, if that is not your primary language, has meant that sometimes pass rates are lower than they should be or could be. Somebody may know the job very well, but just not have the capacity, the English proficiency to take the exam, a multiple choice exam in English. So what we've done is we have developed a piece of legislation, which has actually been introduced by the council. It was introduced by Council Member Henderson, who is chair of the Health Committee, and it has 7 co-sponsors, including Brianne Nadeau, who's my council member, and Matt Fruman, Janice Lewis-George, Charles Allen, Zachary Parker, Brooke Pinto, and Treyon White. It's called the Direct Care Worker Amendment Act of 2020, and it will codify into law a lot of the reforms I just talked about. It would establish a minimum wage that is not less than 120% of the district's living wage, requires DC Health to establish a new universal credential for all direct care workers. We have a bifurcated system now where home health aides have to go through one door and CNAs go through the other, but it's essentially the same job. And it's very difficult for an aide who works in both environments or wants to switch environments. They have to go through a whole nother training process. We've talked about lowering the age of certification, also mandating that the Board of Nursing allow Maryland and Virginia home health aides and CNAs to work in DC, and also requiring the mayor to eliminate those barriers. This legislation has not yet been scheduled for a hearing, but we anticipate a hearing sometime in January. And I'm going to turn it over at this point to Jake McDonald, who is the Senior State Policy Advocacy Specialist for PHI International. PHI International is a national nonprofit that works to strengthen the direct care workforce. And Jake works to improve job quality for direct care workers and strengthen care delivery by developing supportive public policies that improve competency, training, pay, and other dimensions of job quality. So with your help, DC could become a national leader, and Jake is going to explain why. Jake?
Thanks, Claudia. Thank you. And good afternoon to all of you. And this was a really great discussion today. So I track legislation around the country that affects direct care workers. And so I can say with absolute certainty that this bill that Claudia just spoke about, the Direct Care Worker Amendment Act of 2023, is absolutely groundbreaking. It's the strongest bill of its kind in the country, bar none. I know it doesn't address some of the problems that we just brought up on our discussion. It doesn't fix every issue in DC around direct care workers, but it is a really, really big deal. If passed, it would take a really big step in uplifting the workers who are really the backbone of our long-term care system. So today we've talked about how invaluable direct care workers are, but also at the same time, how they're undervalued and underpaid so much that we're not attracting and keeping the workers we need. So I wanted to talk just a little bit about why that contradiction exists and why this bill is so important to create equity. So I've come to believe that the reason for this situation is because these jobs are either invisible to most people or they are wrongly understood as being low skilled. The workforce is mostly women and people of color and disproportionately made up of immigrants. And most are paid for through the Medicaid program. And finally, they largely serve people who are older and who have disabilities. And every part of that kind of adds to the problem. At the core of it is this historic and ongoing injustice and inequity where women, specifically women of color, are portrayed in sexist policy imagination as innately inclined towards caregiving. Thus, this work is seen as a labor of love and not a real job, which is a terrible misconception. Likewise, racism has relegated people of color to low-wage sectors like direct care that exploit their physical labor while deny a living wage. And xenophobia also means immigrants are regularly stripped of their labor rights. They're left unprotected from workplace exploitation. And in addition to all of that, the people direct care workers are serving are those people who are older and living with disabilities. Many are low income and on Medicaid. And so this group is frequently invisible to and forgotten by policymakers, as so many of you know, and also invisible to the larger public until that is they or their loved ones actually need care, in which it comes home very, very quickly. So in my understanding, this bill is just crucial to strengthening the care system in DC, in fighting inequity, in fighting injustice, but it's also about the economy. So when direct care workers are more fairly compensated, when we can reduce the barriers to their certification and their ability to move between care settings, and when we can make training better, we're more likely to have workers join the field and remain in the field. And we reduce turnover and we ensure continuity of care for the people getting the care. And it also means all of us can actually have access to professional care when we need it. So direct care workers, I think, as you've heard today, are really the glue that is holding a good part of our society together. They allow us to age in place. They allow us to live with independence despite disabilities. They allow us to stay in our career, knowing our loved ones are cared for. And this bill is really a much, much needed boost to those people who help knit us together and care for us and allow us to work when a loved one needs help. So I hope you all will really do what you can to support this bill. I think DC right now could be an example of what other states can do. So thank you for listening to that, and please consider supporting this bill.
Jake, thank you so much for that. So I want to we just have a couple more slides, you know, what can you do? So we are, you know, asking that village members and villages support the Direct Care Worker Amendment Act, as we've talked about what it will do, but primarily it's one of the primary things is raising that minimum wage. Engaging council members, calling, writing, testifying at hearings. And in particular, many of you already shared some of your own personal stories and the challenges that you have faced, either because you have been caregivers yourself or know somebody who needed care. Those are very, very powerful, and we want to keep, again, raising those stories to council members so they understand how important this is across the district. One of the things that's been a little challenging for us is engaging the mayor. And so we know the mayor has budget forums. They'll be coming up usually February-ish. We don't know the dates yet. She has a forum specifically for seniors, but there are several others scheduled around. She needs to hear from us on this issue. The mayor does not, I don't think, recognize that this is a challenge, and doesn't believe this is at least some of her administrators who work under her have said quite bluntly, we don't believe there's an issue or that this is a pay issue. We think we've done what we need to do. So again, engaging the mayor and helping her understand that this is important to seniors across the district is really, really important. We'd love you. I'm thrilled that we have 71 people on this call, which is amazing, but there's tens of thousands of more seniors in the district, and we want other seniors and family members to understand this issue. And so we need to help educate fellow village members and our neighbors as well. You can stay engaged by joining us. You can join our mail list and attend our virtual meetings. There's also, and actually I think today is the last day, the Direct Care Worker Amendment Act has been nominated as a priority for the Fair Budget Coalition. So if any of you are members or know about the Fair Budget Coalition, if you're a DC resident and a senior or a person with a disability or a family member who's a constituent, basically a DC resident, you can vote for that budget priority. But I think voting ends today. But that's important because the Fair Budget Coalition has a big voice with the council. Let me stop there. We can post, actually, maybe that's the best way to do it, is to post this PowerPoint on the website of the DC Coalition for Long-Term Care, as hopefully LeadingAge and DC Appleseed could do the same thing. But we've included a list of all the council members and their phone numbers, and my information, contact information, Neil's contact information, and Makeda's are here. And if you want to email me and say, I'd like to learn more, our workforce committee meets we have been meeting every Tuesday morning at 9 a.m. for 3.5 years. That's how long we've worked on this and how intently we've worked on this. You're welcome to join. We also are happy to individually come to your village meeting or participate in a village meeting or community meeting to have sort of drill down conversations about these issues. A number of issues were raised today that we really couldn't dive into because of time. But again, we are happy to have those conversations. Let me stop there and see if there are any additional comments or questions. Go ahead, Judy.
There is a new village-wide advocacy group that is just forming and is developing its agenda. I'm quite sure that if those of you, I'm sure some of you are here, I'm sorry, I just can't see. But I believe that this will probably be on that group's agenda. And so I encourage you to, and anybody, can reach out, happy to reach out to me, reach out to your village director and ask about the DCVC advocacy group and getting involved in that. I also, there's a lot of stuff going on in the chat and some really great ideas. I don't see the option to save the chat as a participant, but maybe if the organizers can plan to do that and circulate that as well.
Yeah, I'm gonna go through the chat a little bit, and I see Frank Finnemore has a hand up, but let me see if I can pick up some of the comments. Thank you. I can only do so many tasks at once. Reading the chat and doing the slides, I can't do.
That's all right, Claudia. I can read some of the messages, and so folks saying we need to make our voices heard. If we can provide the village's simple talking points for advocacy. Will we host an advocacy day? We should have a senior rally outside the Wilson building. Will we send out an email with calls to action and language to support this effort? And Barbara Sullivan is happy to hold a town hall webinar on how villages can advocate at the community level. Thank you, Barbara. Folks also want to see the PowerPoint and this recording, so we will work to get the PowerPoint and the recording out to everyone so that you can share this information.
Absolutely. We will be doing talking points. We can do an advocacy day. I love the idea of a rally. Again, once we have dates for hearings or we know when something is actually moving. But I will say that Christina Henderson has been extremely supportive of this. She dropped the bill and has talked about it at other hearings. And if you just want to do something very simple right now, is, call your council member and tell them this is a bill that interests you and you hope that they will support it or will continue to support it. Frank, I see Frank Finneman has his hand up. Do you want to unmute yourself, Frank?
Sure. I just have a few comments and one question. One is I would really hope that somehow we could figure out a way to have those caregivers that are skilled with dementia care to actually make more money because they're not all equal. And I've gone through many caregivers that they could help me with my mother, but then they just weren't skilled. And so when you find that skilled person, you're almost willing to pay whatever. But if there was some incentive for people to become more experts in that area, that'd be great. Also, the long-term carers often limit the amount that they will pay per hour for a caregiver. And so I don't know how those limits are set, but I think that like currently for my mother's, it's like $23 an hour, which is still above what it is with an agency for an individual that what they're getting paid. But I'm wondering if that's also keeping some of the wages lower, because if an individual is making $17 an hour and their agency is charging $30 an hour, and maybe it's partially because the long-term care insurers will only reimburse $23. And then the last thing I want to say is I'm curious about the Family and Medical Leave Act. This doesn't help the direct service workers, but it would help individual caregivers as the laws or the regulations. I don't know if it's the law or the regulations actually. It stipulates that you can only take a full day off. So in other words, if you are a caregiver and you can go on intermittent leave, but if you take if you need to be gone in the morning because you can't get a caregiver that morning, then you can't work that day if you're going to get the benefits paid back to you. As I
Frank, that wasn't the you should contact somebody about that, because intermittent leave includes partial day. At least that was supposed to be in the regulations. It may have changed, but that was the intention when it was initiated.
Then they need to change their family and leave handbook, because it says there that it's got to be a full day.
That's helpful. That's helpful information to share. Yeah, especially if their handbook is inaccurate. So thank you for that. On the dementia care, this is a growing need in the district. We do not really have, there's a brain health plan that the Department of Health has put together, but we really don't have adequate care for people who have dementia. There is one training school, Summa Prime, and a nursing home, Forest Hills, that offers their incumbent aides a little bit higher pay for going through a dementia care certification program, but it is not widespread throughout the district. Again, one of the things that suppresses the pay rates is, again, how Medicaid rates are set and paid. That's a bit of a detailed can of worms to open, but if people are interested, I can certainly walk them through how that works. But that's one of the things that suppresses wages, and not recognizing higher pay for these advanced certifications. We've been trying to get a medication aid training course approved in the district now for 3 years. This is something that's been on the books since 2019, but this would be a career ladder for a home health aide or CNA, and would give them the credential that would allow them to administer medications, which is so helpful. But we have just run into a lot of bureaucratic barriers that make no sense. So again, this is something we've been pushing for, is recognizing that advanced credentials should get higher wages. I see Judy has her hand up. Again, or was that an old hand?
Yeah, no, I did, but then I got distracted by, I was responding to Frank and I got distracted, so never mind.
Well,
no, I know what I was gonna say is I do think, I was gonna raise the question about where DACL fits into all of this, right? They are kind of like it's sort of like the elephant in the room, the fact that they're not involved, or haven't been involved. And I don't know if anybody here has relationships there that can be, you know, kind of deployed on this. I've heard people express an interest, you know, like, oh, I'd like to talk more about that, but then no follow-up. You know, we need them. They have strong connection with the mayor. And I think they could be a really important, they could play a really important role if they chose to.
Any comments about that? Anybody wants to share?
I'll just share, Makita Vanderpoy, LeadingAge DC. We had our annual meeting on the 7th, and we had one of the chief program officer there from DACL. And
Is that Melanie? Melanie? Yeah.
And she said that they really wanted to hear from more of our older adults in the community. So if we can find a way to elevate those voices of residents to their office, you know, certainly I can support in any way I can to communicate that, to set something up. That was the feedback that I received.
So this is really super important that we as villages get this information out to as many members as possible, and try to document or get people to write letters, whatever, to DACL, so that they can hear from this, as well, along with the videos that Mary shared with us earlier.
Yeah, I think that a very important target, I hate to use that word, is actually the mayor herself. Some of you know, I was the former Medicaid director and worked in the government for many years, and I've been out of government for about 5 years. But the agency directors, unless this becomes a priority for Mayor Bowser, the agency directors likely will not take a lead. So it is really, really important that we engage the mayor and get her to hear some of these voices and some of these concerns. She's been incredibly responsive to seniors who want pickleball courts. I will tell you that. And
don't disagree, but don't forget that the director of DACL is her best friend, and I think that we can.
Yes.
That, you know, that influencing one might be more accessible than the, might be easier to get to the director.
I'm just saying, it's got to be both, because we've talked with Sharon Hines actually, and you know, we've talked with Sharon, but yes, but the mayor does want to hear from seniors. She absolutely does. So, okay, so I see that there are meetings happening. Capitol Hill Village has been hosting a monthly webinar on vulnerable members. What I'm gonna just say, and you know, the coalition is a completely volunteer organization, like, and so are many of the villages, I know. But we are volunteer. Sometimes we're not as technologically astute as we should or need to be. Pulling these videos together. And by the way, I want to, the last slide, and I forgot to show it, was a shout out to Rick Reinhardt and Sal Salveggio and Mary Proctor and Susan Sedgwick, all who helped produce those wonderful videos. So thank you to all of them. I really appreciate the work that they did. But we don't have fancy listservs. I mean, I have an email list. We're trying to work on that. But if you want more information, just reach out to me. You saw my email there. If you don't know how to get a hold of me, get a hold of Judy or somebody else. Most people know how to get a hold of me some way or another. And we will get you involved. If you have meetings that you would like us to come and present at, let us know. We're happy to be there, particularly if it's virtual. It's very easy to do that. But you know, and we are literally building to, after the new year, we know this bill is going to be scheduled for a hearing. We will have talking points. We'd love to see 30, 40, 50 seniors testifying in favor of this bill, sharing their personal stories and explaining why it is so important to pass this legislation. So with that, we are 13 minutes over time, but we've covered a lot of ground. Any last comments or for the good of the order here?
Huge thanks to the to our hosts and Claudia, to you for carrying all of this work, for the last several years. But really huge thanks for pulling this together.
Well, thank you. And thank you all for attending. I'm just thrilled to see so many villagers from so many villages across the district. This is wonderful.
I echo that. Thank you, everyone. Thank you, Claudia. Thanks everyone who had a role to play in creating these videos, and we hope to be in conversation again soon.